Hello again, everyone, and welcome to Health Center Dialogues. I'm your co-host, Lorraine Brooks, and we're going to be doing another edition of our show with my very able-bodied other co-host, Julie Black-Peart, from our Department of our Physician Assistant Program here at Downstate Medical Center. We're going to be talking about a topic today that is, I think, very confusing to most of our listeners. I know it was confusing to me, and I'm looking forward to doing today's show so that I can get some answers as well. And that topic is what we unofficially refer to as Obamacare, but the official title is the Affordable Care Act. And just the name in and of itself can be rather confusing. I will admit, I had to do quite a bit of research before I did today's show because I am as confused about this as anyone else. And I think that's a good thing because it gave me some questions to ask our guest on today's show. So I hope that by the end of the show today, you will have a little bit more information about the Affordable Care Act, and it'll start to make a little bit more sense to all of us. Our guest on today's show is Dr. Daniel Elke, who is Assistant Professor of Health Policy and Management in our School of Public Health here at Downstate Medical Center. Dr. Elke, thank you so much for agreeing to be on our show today.
Thank you for having me.
Thank you for coming.
You see I've got 75 pages of notes here. In the process of doing research to figure out even what to ask you about this, I found that I actually raised more questions than I answered, which I thought was kind of a good thing because
it is a good thing.
At least it gives me a starting point. So why don't we say that, first of all, what does the Affordable Care Act mean? What does it mean to me? What does it mean to our viewing audience? What might it mean to somebody who's been previously uninsured or underinsured? Yes. Does it make a difference? Why do we call it the Affordable Care Act? You can just answer any one of those questions.
Very good, very good. I'll try to hit on all of those points, hopefully within an hour or so. Okay. We'll hit upon all of those. First of all, this is a piece of legislation that goes by about 10 different names. Yes. The full official name is the Patient Protection and Affordable Care Act. So you often hear people refer to it as PPACA if they feel like they're in the know. The Affordable Care Act, ACA, and as you noted, Obamacare has been the
unofficial. So they're all synonymous. All of those things mean the same thing. Okay.
Absolutely.
Yeah,
and they all describe the same 1,000 or so page piece of legislation. And within those 1,000 pages are bits and pieces that affect just about every part of our healthcare system. Okay. First of all, though, I want to address the parts that deal most with making care more affordable and just say a bit about what that could possibly mean. It's a bit of a misnomer to say that the legislation is first and foremost about health reform. I just said a moment ago that there are bits that affect every part of our healthcare system, but many of them are tweaks. They affect them in small ways.
So it wasn't intended to be a blanket
all-encompassing.
No, not at all, not at all. Okay. It was sold that way, I think, to some extent, but what we're really talking about at the end of the day is health insurance reform.
Okay.
And that's not the same thing as saying health care reform or reform of healthcare access. Access being a huge issue in our healthcare system.
So that is the beginning then of the misunderstanding, because that is exactly what I thought it was, and you just
I believe so.
That is not
a lot of people
Absolutely.
thought that we were trying to do something similar to what other countries have, in like Canada
Yes.
or whatever, have universal health care.
Yes.
But that really wasn't the goal here at all.
Not at all. This was
Okay.
designed to sit somewhat neatly on top of our existing system rather than clear everything in its wake. So in effect, this is a system, a reform that's designed really to help make our system more sustainable for perhaps the next several decades. That's why, by the way, many who advocate for a national health insurance system actually oppose the legislation. Not because it's trying to do some good things in terms of expanding health insurance to populations that previously did not have it, but because they believe that it helps to support the existing system, which they would like cleared away and replaced with a system of national health insurance.
So this was I'm sorry, Julie.
Go right ahead.
This was in no way intended to provide universal health insurance or blanket health insurance or 100% coverage for the, okay.
Not
So
at
let's
all.
start
That's
there.
that's
So
correct.
We're going to debunk that myth.
Very good, very good. No legislation that keeps completely out of its language undocumented immigrants could be said to be at all universal.
Correct.
Okay.
So undocumented immigrants are not
not
covered by
included.
these.
Not at all. Not at all. This caused some confusion. You may recall that President Obama gave a speech at which a congressperson accused him quite publicly of lying on this issue. He did not, in fact, lie. The legislation, much to the chagrin of many public health professionals, completely excludes undocumented immigrants.
Well, while you're saying that, I understand, and please correct me if I'm wrong, I understand that there are some groups, though, that have been previously not included or previously under-included, if there is
Yes,
such a thing.
absolutely.
For example, LGBT population, victims of domestic violence, that sort of
Yes.
thing. Can you speak to that?
Absolutely, and these are actually in some ways some of the lesser known provisions, not the so-called headline marquee items, but they're every bit as important, I think, as the ones that are often at the tips of our tongues, so to speak. First of all, when it comes to LGBT individuals, the legislation prohibits discrimination on the part of insurance companies or anyone that is trying to sign up individuals for insurance coverage.
Just for clarification,
Yes.
LGBT is lesbian, gay,
Correct.
I was
Correct.
gonna say that because maybe some people
Bisexual
might
and
know.
transgender.
And just before you go on, a quick question, because there's all this
Yes.
wonderful stuff that's going on now with the different states and the new rulings about ability to get
Quite,
married.
yes.
Now, are they two tied in together, or they don't have anything to do with one another?
I would say they come from the same wellspring of social reform,
Okay.
if you will, that is trying to broaden healthcare, health insurance certainly,
Okay.
to populations that were formerly excluded, just as many of the rulings on gay marriage are trying to open up the institution of marriage to populations that were previously excluded.
Okay, well, let's carry right on with it.
Very good. In terms of Native Americans, for instance, there are some special stipulations in the legislation. You may be aware of the fact that when it comes to the health insurance exchanges, which we'll talk about in a bit most likely, there is an open enrollment period, and it's becoming shorter and shorter to some extent, only about 5 months or so. The rest
what
of
do
the
you
time.
mean by open enrollment?
I was going to ask about
yeah.
it. It's coming up on the 15th.
Absolutely.
Isn't it? It's the
We're in the
deadline.
middle
Absolutely.
of our open enrollment.
It's almost over.
It is
Well,
almost
as we're filming this, what is
Yes.
today's date?
Yeah.
February 12th. Right?
Yes,
Okay.
that's correct. So there are only a few days left in the current open enrollment period. And what this means is it's the window of opportunity during which individuals can sign up for health insurance on the exchanges. After that date, they are effectively locked out unless they can claim certain hardships. Or they belong to certain groups. And that's the case when it comes to Native Americans who can purchase insurance at any time. And are also excluded from many of the cost-sharing provisions as well when they purchase insurance on the exchanges. When it comes to victims of domestic abuse itself is counted as quite logically a hardship, and therefore they allow victims of domestic abuse to sign up for insurance at any time. And also, they prohibit insurance companies from using a history of domestic abuse as a pre-existing condition, which, believe it or not, was the case
Was
up
the
to this
case,
point.
correct.
Now, if they don't sign up by the 15th, then it's, what is it, once a year it opens up again? That's it?
Correct.
Just once a year and that's it?
Correct. It's
Okay.
open for about 5 months or so.
Every
And
year.
it's going to be
so-
the same period of time each
It'll be the
year?
same period of time each year after this. It was a little bit longer. I believe there was an additional month or two added to the first
Because this was the
period
first
because it
period.
was the first time, and now
Okay.
we're moving into sort of the smooth operation of the system, and they're going to keep it at the present window.
And they have all these different levels. There's standard, and then there's non-standard, and then we've got the metals. We've
Yes.
got
Oh,
platinum, gold, silver, and bronze, which are different levels of
Correct.
these plans. Could you just touch a little bit on that so people
Absolutely.
know what it is?
The gold, silver, platinum, etc., the element plans, if you will, simply refer to basically the generousness of these insurance plans. That is, how much they cover, how much cost sharing is involved in some cases when it comes to deductibles,
So not-
co-payments,
okay.
etc.
Okay.
So the more bare bones plans would not, for instance, be counted among the gold. The gold would cover just about everything under the sun, while fewer things might be covered under the silver, platinum plans.
And it's up to the consumer to decide which plan
It is.
they
Like
Yes,
they choose.
absolutely.
Okay.
Absolutely.
And what's the difference between standard and non-standard?
Standard and non-standard, I believe that refers to the grandfathered plans, or
Yeah, the
those
10,
that,
those
yes.
basic things. I know they get
Yes.
prescription coverage, and they get to go to HMO, in-network, or
In-
whatever.
right,
have you.
out
There's
of
like 10
panel,
things,
yeah.
and then if it's a non-standard plan, there are additional things like vision and dental
Yes,
that might not be
yes,
part of
there
the
are extras that are
Right,
added on to
okay.
those plans
Great,
as well.
Great,
Yes.
lots to choose from.
Yeah.
Lots to
Indeed,
choose
indeed,
from,
a smorgasbord.
But doesn't that in some ways, I know from, I'll just speak for myself.
Sure.
When I go to Home Depot, it's too many things. I can't decide, you know? There's too many choices.
Yes.
Yeah.
And
Yes.
sometimes when there are too many choices, I personally get even more confused because which
Oh,
one
yes.
is better for me?
Absolutely.
So how can the average consumer who doesn't understand policy the way that you do, and maybe doesn't understand the healthcare environment the way we do because we work in it, but how does the average consumer make any sense out of what to do for their family? I'm a mother. I have, 3 children under the age of 15. I mean, how do I?
That's an excellent question. I think it's one that is largely remained unanswered when it comes to policymakers.
I hate when my questions remain
Yes. Full disclosure. I am covered under my employer, and it's important to note this is one of the ways in which the system is largely remaining the same. The majority of Americans will continue to get coverage through their employer, and those individuals will not be shopping on the exchange at all.
Okay.
So when we talk about the average consumer, we're really talking about those who are not offered insurance from their employer or from another source, Medicare,
or
Medicaid,
are
Veterans
unemployed.
Health,
Right.
etc.
Okay.
Yes, it's exactly. And so they would be on the individual insurance market. And I think you're exactly right. This is something that is very difficult to learn. We are not, as Americans, accustomed, I think, to shopping for health insurance
Yeah.
in much the same way we would any other commodity, like
Right.
at Home Depot or
You
otherwise.
go to a job and you take the plan that they're offering. That's what
Absolutely.
it is.
Yeah,
You
right.
know?
And I think what the government is hoping for, what the administration is hoping for, is that with practice, this will become something that we do become accustomed to over time, and that we will become smart shoppers. But knowing that that's going to be an uphill climb, they're trying to make certainly the websites as easy to understand as possible. The exchanges are structured so that plans are set side by side. You can, in theory, at least easily
You
compare.
can compare them.
Absolutely.
I took a look at it, and actually, although it's a rather lengthy document, you can choose relatively easy and compare side by side because it's all laid out exactly the same way. The deductible, what the co-insurances, if any, the copay, if any, and it's exactly the same
So
on
you're
each
comparing
page.
apples to apples.
Yeah,
That's good.
it wasn't very confusing at
what
all.
it involves, I think, is for many people to become more discriminating consumer of health insurance. Again, this is not something we're accustomed to, but it isn't necessarily a bad thing because I think as Americans, it's not a bad idea that we have a better idea just what we're paying for and just how much we're paying for, rather than having it, for instance, taken out of our paycheck, just automatically occurring. I think it's not necessarily a bad thing for us to become better consumers of health insurance and of healthcare generally.
So explain the concept of exchanges, if you would.
Absolutely. These are effectively virtual marketplaces that are active in each and every state. So there are effectively 50 different exchanges, and they are websites, large websites, on which consumers can look at plans side by side and select the plan that is appropriate
So that's
for
what
them.
you were just describing.
Yeah, that's what I was
exchange,
Exactly.
where you can go and look.
Right. Now, and this is what they were making all this hullabaloo about in the beginning, how it wasn't working right and everything. Well, I went on and it just seemed to be working fine. So they've gotten all the kinks out of it, so there's not to worry there for our viewing audience. Okay, good. All right.
What if you don't have access to a computer?
There are a whole team, a large team in fact, of so-called navigators that are designed to work with people and are available at community health clinics, for instance, in some cases libraries, other public places, and it is their job, effectively. They contract with the government in order to offer assistance at public places where computers would be available and sort of walk people through it.
Okay.
Well, that's good to know because many of the people who tune into our show are not you know, some are unemployed, some don't have access to the same materials that we have access to. But I want to get back to a couple of the just very basic questions. I think the name says it all. It's the Affordable Care Act.
Yes.
It's not the Free Care Act.
Absolutely.
It's not the Let's
Absolutely.
Insure Everybody Without Copay Act. It's the Affordable
Yes.
Care Act.
Yes.
So what is it about the act, or what is it about the legislation, or what is it about the whole scenario that makes it affordable, or why is that the crux of the matter, or is it?
It is a really, you know, something that works perhaps more in theory right now than in practice. I think the jury's still out as to whether we're going to see big cost savings when it comes to our healthcare system generally, or whether the majority of people will see large discounts. But in design, it is designed to foster greater competition among insurance plans. Remember, if people are more savvy shoppers, theoretically you will have more insurers offering more plans, more products, perhaps at a lower cost as well. And the cost is
The
made
other side
lower.
of that, though, is that you have to educate yourself first.
Absolutely,
before you know what you're
absolutely.
buying, just like buying a
Yes.
car.
The demand will run the supply
Right,
of the
exactly.
Absolutely. And it's important to mention the fact that for those who make between 138% and 400% of the federal poverty line, there are subsidies available from the federal government that help toward the purchase of health insurance and help to cover the cost. And there is a ceiling above which people may not spend on health insurance. So it's about, depending on the specific group, it's about 8% or so. So it's capped at 8% of income, which is still a huge number, by the way. That is a lot. So many people will fall under that, but for those who can't find an affordable plan at all, they are exempted from the mandate that they have coverage.
See, now I didn't know that, because a lot of people were afraid that they wouldn't be able to afford it. What does this mean for the small business owner? There was some discussion about small business owners not being able to afford insurance for their employees. Or what kind of impact has this had? And are they enrolling the numbers of people that they wanted to enroll? Because that was another big thing. They were saying not enough people were signing up.
Yes. Well, part of the problem was we thought that the individual marketplaces got off to a rough start. The small business exchanges were also delayed in effect. So that's another area in which we're still waiting to figure out just how smoothly, really, year on year, small business enrollment is going to go. The smallest businesses are exempted from this. Those under about, I believe it's 50 employees or so, are exempted from this. So the smallest small business.
Really? I would have thought that would have meant
they
maybe
don't have to
10
offer
or
coverage.
20
They don't have to
people.
offer coverage. They may instead direct their employees to the exchanges.
Oh, wow.
So this is another group that would likely be buying insurance on the exchange, those who are from the smallest businesses. And the idea is that for medium-sized businesses, in the main, these businesses should be able to afford the expense. That is not always going to be the case, obviously. And there are some businesses that, yes, are probably going to suffer, may have to lay off some employees as a result. You know, I think we have to admit that up front. But the hope is that that number is going to be very small. Again, we'll see in the coming years.
Yeah, with every good thing, sometimes there's some risk and some
has
things
to be
that do
downside,
fall
sure.
to the
Absolutely.
wayside. But by and large, when you really think about, you know, healthcare across the board, I mean, what are we doing? We're saving lives. We're getting preventive care to people who never
May
would
not
go to
have
the
had
doctor
this.
for the smallest of things, who can now go.
Absolutely.
And that's really the whole plan.
That's
We're
the
living
bottom
so
line.
much longer these days because healthcare has gotten better. Now, access to it has to be better too, and this is where we're taking it.
Indeed.
But you mentioned earlier that this plan is not really designed to improve access. Per se.
Not
So
per se.
what
Yeah,
does that
let's touch
mean?
on
actually?
that.
Yeah, absolutely.
What
Well,
does access mean, and what is it?
access means, you know, you are given certain subsidies to buy insurance. You get health insurance. After you get insurance, is there a physician? Is there a provider who's nearby? Is this convenient to get to? Can you actually make an appointment?
actually
Is your
utilize it?
perhaps the physician you're used to visiting or the hospital you're used to visiting, do they take your insurance.
Are they participating?
So that's the big wrinkle there. Having insurance does not guarantee access in the least, and I think that's something that's very often overlooked. Now, there are parts of the legislation designed to increase access. For instance, there are programs of loan forgiveness, loan repayment for those medical students who are going into primary care, because we know that we're going to need more primary care physicians going forward. And so it's hoped that, you know, in the next 10, 20 years, programs like that at least will increase the supply. But that's not going to happen immediately, obviously. And so it's thought that we're going to have a lot of new individuals who for the first time have insurance and may be raring to go to make an appointment to a physician, and the physician may not be available, either, you know, not being nearby or not in network.
I'm glad you mentioned that, because President Obama has new initiatives that actually have been very positive for specifically the physician assistant profession, right? Because there is a dire need for primary care providers. A lot of people graduate from medical school, they graduate from physician assistant programs, and they want to get into these other areas, dermatology, specialty. But there's been long call for people to please get back into primary care. But it doesn't typically pay as nice, you know, but the initiatives have to be there, and that's what we were really bred for, primary care, all right, of people. So this has been an area where this profession that I am in will be seeing a resurgence and some growth opportunities for doctors who they might not want to do it. They got a couple of PAs on board. More power to you.
Okay.
You know?
You know, I'm glad you mentioned that too. And, you know, this is, and again, I consider myself a pretty average consumer. So I'm thinking if I'm home and I'm listening to President Obama and I'm listening to the dialogue, and I think I'm understanding this, that, oh, this is great. People are going to be able to get health insurance. People are going to be able to go to the doctor who couldn't go to the doctor before. You know, we got, you know, there's all these groups that are going to now have it.
Absolutely.
But no, wait a minute. Maybe there's
not exactly
a doctor that
not exactly
not quite so much.
And that's why I think it's important to realize that in large part this is a health insurance reform. Some who are more cynical would say this is a sellout to the insurance companies. After all, part of the legislation, which we haven't discussed yet, is the so-called individual mandate that requires individuals to carry some form of health insurance or else pay a tax penalty. And this penalty is run through the IRS. And therefore it's something like a tax at the end of the day. So that could be private insurance, could be public insurance, obviously veterans health, etc. But people are going to begin to be paying these penalties. And what this
kind of
really,
like driving a car without insurance.
Absolutely.
You get a ticket.
Yeah, you get dinged.
Fine, right.
And in this case, you know, some would say that, well, this guarantees an additional audience for these insurance companies, additional business for these insurance companies, guaranteeing new business effectively, and the government, in many cases, paying the tab, or else the consumer paying the tab. So some of the more cynical would say, well, this isn't a reform of the system. This is a sellout to big insurance companies. I don't know if I would necessarily go that far, because it does do other things. But I will say that I think overall it's going to be very good for the insurance companies. They're going to do pretty well out of this, I think.
Well, that's not necessarily a bad thing, because, I mean, we are a market-driven economy, so, you know, that's not necessarily a bad thing.
I think we're getting off to a start here. You know, it takes a while for it to grow, but this whole tax thing, I'm sure, is scaring the dickens out of folks. You know, if you're unemployed and you know now you have to pay for insurance, and then what if you don't get it? I mean, so please, you were going to expand a little bit more on that.
It is very very frightening, and in the first few years it was a fairly small amount, or the equivalent of a certain percentage of income, and that's going to gradually be rising as we move forward in time. So those who are not able to get coverage, or decide not to get coverage, many of those will face a penalty, and they'll have to, on their tax forms, actually check a box that says, you know, I'm covered by insurance. That will then be investigated. You know, it will be made sure that that is actually the case.
Now, the cynical people among us would say, this is Big Brother watching us in yet another way. Right?
Absolutely.
I'm not getting it.
Nobody can tell me that I have to do.
And it's important to realize, too, that there's a little bit of political shenanigans here, because during the run-up to the Affordable Care Act, the whole chorus coming from the administration was, this is not a tax increase. We're not increasing taxes. Well, then the Supreme Court threatened to rule on whether the individual mandate was constitutional. It is constitutional for the government to levy taxes. So they hung on to that argument, and the administration claimed at the end of the day, well, you can sort of think of this as a tax. After they had said to everyone, we're not increasing our taxes.
Read my
At
lips.
the end of the day, absolutely. At the end of the day, it is basically a tax.
Lipstick on a pig?
Yes, it is basically a tax, exactly. And so it will be, taking potentially a large chunk out of people's budgets. Now, it is important to note that there is a floor to that. Below a certain income level, you would be exempt from that mandate. I think many people who are, in the direst economic circumstances would probably find themselves exempt. But it's important to research whether, in fact, that exemption exists for the individual before moving forward. Otherwise, it could be a surprise come tax day.
Well, Dr. Elke, I just got the signal from our producer here that we've only got a couple of minutes left, and I want to make sure that we, kind of wrap it up in a way that people can hang their hat on in a way. Is there a way that people, or a place that people can go? Is there a website that you can give? Is there a phone number that you can give where people can go to find out more information?
Absolutely. I would recommend that those who have further questions, wish to locate further information, go to healthcare.gov. That is basically the central clearinghouse. I was just on there myself a short time ago looking around at all the features. And there, depending on what your questions happen to be, you may get it answered right in that federal website, or you are asked to type in your zip code, and that then sends you to a link to your state health insurance exchange. And so that way you don't have to go through the trouble like Googling or searching for the health insurance marketplace or whatever, which all the sites are going to be different across the states. I recommend that no matter where you are, you start out at healthcare.gov, and that will then take you to the relevant
So
sites.
healthcare.gov is a national
Yes,
thing.
that's correct.
Dr. Elke, thank you so much for appearing on our show. Julie, thank you so much for being my co-host. And thank you for watching Health Center Dialogues. See you next time.